In this video, we'll discuss a couple of neurodevelopmental disorders, including ADHD and autism spectrum disorder. Neurodevelopmental disorders involve developmental problems in personal, social, academic, and intellectual functioning. So we'll briefly touch on attention deficit hyperactivity disorder, or ADHD, which is where there's a constant pattern of inattention and or hyperactive and impulsive behavior that interferes with normal functioning. We'll discuss in more detail on the next slide, but symptoms do include inattention, excessive movement, and hyperactivity. We'll also discuss in a little bit more detail autism spectrum disorder, or ASD. So this is a condition related to brain development that impacts how a person interacts and socializes with others. It causes problems with, as we just said, social interactions and communication. So the symptoms of ADHD involve inattention and hyperactivity. So the inattention is going to involve difficulty sustaining attention, failure to follow instructions, disorganization, and lack of attention to detail, as well as being easily distracted or forgetful. The hyperactivity includes excessive movement, interrupting and intruding others, blurting out responses before questions have been completed, and difficulty waiting one's turn. ADHD occurs in about 5% of children, and boys are 3 times more likely to have ADHD than girls. If not treated, it can result in low educational attainment, low socioeconomic status, unemployment, low wages, substance abuse problems, and relationship problems because of this inattention and the hyperactivity combined. The symptoms of autism spectrum disorder include deficits in social interaction. For example, they don't make eye contact, they turn their head away when spoken to, they prefer playing alone. Deficits in communication, one-word responses, difficulty maintaining conversations, echoed speech, problems understanding nonverbal cues, and repetitive patterns or behaviors or interests. ASD is going to affect approximately 1 in 88 children in the US, and it's 5 times more common in boys. It does seem to have a genetic component, with identical twins having a 60 to 90% concordance rate, meaning that if one monozygotic twin has autism spectrum disorder, the other twin is likely to have a diagnosis 60 to 90% of the time. Fraternal twins only have a 5 to 10% concordance rate, so it really does suggest a highly genetic component. Genes involved appear to be those in the formation of synaptic circuits that facilitate communication between different areas of the brain.